Imagine cracking an egg over the pan when, snap, the spatula slips straight through your fingers and smashes on the tile. Your hand isn't clumsy, it's gone offline. Half the room dims as if a blackout switch flipped in your brain. You try to shout, "Help!" but the sound dribbles out like static. No one will knock on your door for hours, and right now nearly 3 million neurons are dying with every single heartbeat. Memories, words, even the strength to stand. What you do in the next 180 seconds will decide whether you ever speak to your family again. Stay with me. I'm about to hand you the 5-step plan that can keep your brain and your life intact when a stroke strikes you home alone. If you think stroke only happens to other people, or that you'd recognize one immediately, you're not alone, but you might be dangerously wrong. Most people believe strokes announce themselves with dramatic chest-clutching moments like in the movies. The reality is far more subtle and infinitely more dangerous. Studies show that nearly 40% of stroke patients initially dismiss their symptoms as fatigue, stress, or getting older. This deadly hesitation costs brain function that can never be recovered. If you or someone you love spends any time alone during the day, please hit that like button right now. This information could literally save a life, and I need your help to make sure it reaches as many people as possible. Type "Brain Saver" in the comments if you're ready to learn the 5-step survival plan that neurologists use to outsmart stroke when help seems impossibly far away. Here's what most people don't understand about strokes. They're master manipulators. A stroke doesn't just attack your body. It attacks your judgment, your ability to think clearly, and your capacity to recognize danger. Research published in the Journal of Stroke and Cerebrovascular Diseases reveals that stroke patients often experience something called anosognosia, a neurological condition where the brain literally cannot recognize its own dysfunction. This is why waiting to see how you feel can be fatal. The first step in our survival plan is recognizing the attack before your compromised brain talks you out of it. You cannot rely on instinct here. You need a mechanical checklist that works even when your thinking is impaired. Stand up carefully if you can do so safely. Grab your phone, open the selfie camera, and run what doctors call the BEFAST drill. Balance first. Is the room spinning around you, or do you stumble when you try to walk? Even a slight sense of unsteadiness counts. Eyes next. Has your vision suddenly blurred, doubled, or gone dark on one side? This isn't gradual vision loss from aging. This is immediate and dramatic. Face assessment. Try to smile wide in that selfie camera. Does one corner of your mouth refuse to cooperate or feel numb and tingly? Arms testing. Raise both arms straight up and hold them there for 5 slow seconds. Does one arm drift downward or feel weak and heavy? Speech evaluation. Say out loud, "The sky is bright and blue today." Are your words slurred, garbled, or do they feel stuck in your throat? Time documentation. Look at the nearest clock and burn that exact time into your memory. Here's the critical part that could save your life. One single warning sign is enough to assume stroke and take immediate action. Medical research shows that every minute of delay allows 1.9 million neurons to die unnecessarily. There's no prize for being tough or waiting it out. If you found this information helpful so far, please give this video a quick like to help others find it. Your engagement literally saves lives by pushing this content to people who need it most. The second step is summoning professional help even when your speech is failing. Grab your phone, press 911, immediately switch to speaker mode, and announce clearly, "Possible stroke." Face drooping and arm weakness started at, give them that exact time you memorized. "I am alone at," state your complete street address. "My door is unlocking now." Then leave that line open no matter what happens next. Modern emergency dispatchers are trained to work with stroke patients whose speech deteriorates during the call. They can track your location through your phone and monitor your breathing patterns even if words become impossible. If your fingers won't cooperate with the keypad, activate your phone's emergency shortcut. On most smartphones, press the power button 5 times rapidly. If you have a smart speaker nearby, call out, "Hey Siri, call emergency services," or "Alexa, I need help." Here's something that might surprise you. Skip the aspirin completely. Many people think aspirin helps all strokes, but nearly 40% of strokes involve bleeding in the brain rather than clots. Taking aspirin during a hemorrhagic stroke can turn a manageable brain bleed into a catastrophic flood. A study in the New England Journal of Medicine found that inappropriate aspirin use during stroke increased mortality by 23%. Your job is to get professional scanning equipment involved, not to guess at treatment. The third step is making entry simple for the paramedics racing toward you. Every second you save them is brain tissue preserved. Unlock your front door immediately or trigger your smart lock's emergency access code. Turn on your porch light and any hallway lights, even during the day. This helps responders identify the correct entrance quickly. If you can still walk without significant staggering, position yourself within direct sight of that main entrance. Take 30 seconds for these crucial preparations. Herd any pets behind a closed door so they don't interfere with medical care. Kick throw rugs aside with your foot to prevent tripping hazards, and turn off any cooking appliances or candles. These tiny actions can shave 3 to 5 minutes off response time, and neurological research confirms that every minute saved preserves roughly 1.9 million brain cells. Step 4 focuses on protecting your body while help travels to you. If weakness spreads to your legs or dizziness intensifies, don't fight it. Ease yourself to the floor in a controlled manner and roll onto your side. This is called the recovery position, and it's designed to keep you safe if consciousness wavers. Bend your upper knee forward for stability, let your lower arm cushion your head naturally, and angle your chin slightly downward to keep your airway completely clear. Use whatever's within reach, a folded towel, sweater, or small pillow, to elevate your head about the height of a paperback book. This slight elevation helps maintain blood flow to your brain without overworking your cardiovascular system. Control your breathing deliberately. Inhale slowly for a count of 4, then exhale for a count of 6. This prevents hyperventilation, which can actually constrict blood vessels and worsen brain damage. Research in the journal Stroke shows that controlled breathing during acute episodes can improve outcomes by up to 15%. Resist any urge to eat or drink anything, even water. Stroke can compromise your swallowing reflex without you realizing it, and choking would create a second life-threatening emergency. Loosen any tight collars, scarves, or belts to ensure unrestricted blood circulation. The fifth and final step could dramatically change your treatment outcome. Capture real-time information using your smartphone's voice recorder. Medical professionals need precise timing and symptom progression to choose the most effective intervention. Speak into your phone's recorder. Right arm numbness getting worse. Vision still foggy on the left side. Started at 8:44 this morning. My regular medications include lisinopril 10 milligrams daily, atorvastatin 20 milligrams nightly. I have not taken any aspirin. Continue narrating whenever you notice changes, even if your speech becomes slurred. This creates a timestamp record that emergency physicians use to determine treatment eligibility. Long before an emergency occurs, prepare what doctors call a brain bag, a clear plastic envelope taped to your refrigerator door. Inside, place photocopies of your photo identification, current medication list, documented drug allergies, and a note reading, "Transport to certified stroke center preferred." Paramedics actively look for exactly this type of prepared information packet, and it can accelerate lab work, brain scanning, and treatment decisions by 20 to 30 minutes. Let me walk you through a complete scenario so this becomes automatic. You're reading the morning paper when your vision suddenly blurs. Immediately grab your phone, open the selfie camera, and run, be fast. You notice your smile is crooked and your right arm feels weak. Call 911 on speaker. State, possible stroke, face drooping, and arm weakness started at 7:45 a.m. I'm alone at 123 Main Street. Door unlocking now. Unlock and light your entrance, then position yourself nearby. If symptoms worsen, assume the recovery position on your side with your head slightly elevated. Record your observations and medication history on your phone's voice recorder. Research from the American Heart Association shows that clot-dissolving medication is most effective within 4.5 hours of symptom onset, but newer mechanical clot retrieval technology can work up to 24 hours. However, the single largest factor determining your outcome isn't which hospital you reach. It's how quickly you start this chain of survival. If you're thinking this seems like a lot to remember under pressure, you're absolutely right. That's why I recommend taking 3 minutes every Sunday morning to practice these steps. Run through the Be Fast self-assessment, practice your emergency call script, unlock your door, and assume the recovery position on the floor. This type of rehearsal creates muscle memory that functions even when your thinking is impaired by stroke. Prevention remains your most powerful weapon against stroke. Manage your blood pressure consistently. Even borderline high readings significantly increase stroke risk. Monitor your cholesterol levels, maintain stable blood sugar, limit alcohol consumption, and eliminate smoking completely. After this video, I encourage you to explore evidence-based prevention strategies that can reduce your stroke risk by up to 80%. But here's what I want you to remember most. Strokes are medical emergencies, not medical mysteries. The difference between full recovery and permanent disability often comes down to the actions you take in the first crucial minutes. You now have the knowledge to recognize stroke symptoms, summon appropriate help, and protect yourself until professionals arrive. If a single strategy from today's video could save your brain function or someone else's life, type yes in the comments below. Subscribe with notifications enabled so you never miss emergency preparedness content that could matter when seconds count. Share this video with every parent, grandparent, neighbor, or friend who spends time alone. Your recommendation might be the information that saves their life. I read every comment, and your personal experiences often become the foundation for future life-saving content. Until next time, stay prepared, stay informed, and keep living the vibrant, independent life you deserve. Remember, this information is educational and should never replace personalized medical advice from qualified healthcare professionals who understand your unique health circumstances.